Hello. Right. Okay. I am back, guys. Rheumatology is not everybody's cup of tea. I've tried to keep it simple. I'm just focusing on common things. I'm just focusing on those things which keep appearing in the exam. Is everybody back? Okay. I want a correct answer, please. Mariam, what is the answer? Azra, Maria, Sadia, Sajid. Correct. Very clever. I agree with you. Right. Okay. Very simple question. I like simple questions sometime. Do we know why this is DEXA scan and why not MRI scan? Osteoporosis is measured in terms of DEXA scan. Gives T-score to assess bone mineral density. The most common signs of osteoporosis, right? Decrease in height over time because you lose height in your vertebrae, hunched or stooped posture, back pain, especially lower back pain, secondary to a collapsed vertebra, easier than usual bone fracturing. That is how osteoporosis shows itself. Fractures are the first clear symptom of osteoporosis and can cause chronic pain. Spinal fractures commonly, not always, are due to
Hmm?
osteoporosis.
Yeah.
Okay, let's move on. What is the diagnosis here? And what test will you do? What investigation is most specific for confirming this? Any offers? Anti-CCP antibodies, correct. What is the diagnosis of this condition? Rheumatoid arthritis. So anti-CCP levels are more specific. Rheumatoid factor is raised in 70% of the patients, but very non-specific. And it is not only due to rheumatoid arthritis. So that is your differential diagnosis of rheumatoid arthritis. Almost every rheumatic disease can mimic rheumatoid arthritis. Psoriatic arthropathy, osteoarthritis, lupus, viral arthritis, reactive arthritis, arthritis of inflammatory bowel disease, Lyme arthritis, and palindromic rheumatism. A list for raised rheumatoid factor is huge. I don't need to do this. Why I have made this list is just to give you a rough idea that there are several tens of diseases which can cause raised rheumatoid factor. So be very careful. There's hardly any point asking this investigation, to be honest. Okay, male. 5-day history of pain in the. This is a very typical triad. The knees, the knee is swollen, On further questioning, he administered dysuria for 2 weeks. Very easy. It's a typical exam stuff. Reactive arthritis. Sifsa, you're spot on. Thank you. Reactive arthritis, Reiter syndrome, which is combination of conjunctivitis, urethritis, and arthritis triad. That is, can someone tell me what is this? Are you taking regular online classes? Well, sometime. Remember, this takes a lot of effort to make one slide. This course has taken me 6 months to be able to speak for these 2, 3 hours. So this is your arthritis, this is your conjunctivitis, this is your balanitis, right? So that is your triad of your pathology. Can't see, can't pee, can't climb a tree. That is typical picture, typical presentation. Okay, describe the findings in this picture. Can someone give me a description? Are you able to tell me what do you see? You're getting the diagnosis right. Impressive, but I will be pleased if you are able to give me a description of these lesions. Silvery, scaly on an erythematous base. That is the description, right? Silvery, scaly. Psoriatic plaques, correct. So, what is the underlying pathology that leads to appearance? What is the underlying pathology? Hyperkeratinization. So, hyperproliferation of keratinocytes leading to an increased cell turnover in epidermis. Normally in 3 to 5, normally 28 days, but in psoriasis, it can occur in 3 to 5 days. So that is the pathology. So hyperproliferation and hyperkeratinization, rapid turnover. That is what it is. That is the question commonly asked. Okay, what is the diagnosis here? Uh, There's lots of variation in your diagnosis. I need one correct diagnosis. Majority are getting it right. Ahmad Sultan, your diagnosis is correct. Sajid Azad, correct. Zoom user, correct. Sumera, correct. Okay, this is dermatomyositis. What rash do you see on this hand? So these are various rashes of dermatomyositis. Look at this, at the knuckles, right? Periungual, right, on the eyebrows. These are typical places where these rashes you can get in dermatomyositis. Nawal, are you in agreement with me or you have a different opinion? Okay, right. If you're all in agreement, I will move. Okay, let's move. My apologies if you think this is a little bit of repetition, but I just felt that this is such an important issue that I need to emphasize a bit further. What is the answer here? Again, that is how your crust fracture looks like. Okay, got it right. Thank you. It's easy. Let's move on. For students, these are called crush fractures, and this is usually due to osteoporosis, and this is evaluated by DEXA scan. Okay, slightly more challenging, guys, but I'm sure that you are a very clever bunch of people. I'm sure that you will get it right. Examiners love this question. It's fairly common, to be honest, when people present with this condition. And you are getting it right. Very impressive. Very impressive. So, what is fluid microscopy? Basically, learning point is that if you have got a fluid, synovial fluid, you get it, you aspirate it, and you send it for uh, crystals, right? So, rhomboidal weakly positive bifurcant crystals under polarized lies, pseudo gout, right? Needle shape negatively bifurcant. You know what is Reed Sternberg cell and where do we see it? In Hodgkin's. True. So what is this? Can someone tell me what is this? These arrows show what? What is chondrocalcinosis? This is chondrocalcinosis, reduced giant space. And what is this? This is gouty tophus, tophi. This is your Reed Sternberg cells, right? This is your gout. And this is how your pseudo gout looks like. So this is just comparison of your gout and pseudo gout. This is a very common favorite questions by examiners. How do you compare? What are the needles look like? So this is your needle like. This is your rhomboid. So this is negative, weakly positive, which is consistent with pseudo gout. So this is usually in the knee. This is in the first MTP joint. So that is how it looks like. Any question on this? So these are your, look at these white lines, chondrocalcinosis. This kind of imaging is very common in the exam, asking about chondrocalcinosis, which is feature of pseudo gout. Painkillers work in both conditions. So these were the few commonly asked questions in um, rheumatology. I think that probably we will not